When I was told I had kidney cancer, it came as an absolute shock, completely out of the blue. At the time, I was working full-time. I'd got 2 sons, aged 12 and 10, a husband, very busy life, socially as well as working. And I put the tiredness I was feeling at the time down to perhaps just that busy lifestyle. Then I started to have a few pains in my side and took myself to the doctors, and he sent me for a scan. That led to a CT scan, and from there I was told that I'd got a tumour on the kidney. It really was very scary. If I asked questions, people didn't know why I wanted to know the answer, and I just didn't know where to go. And I just really wish something like the Kidney Cancer Support Network had been available to me at that time.
Like many kidney cancer patients, I'd actually been investigated for something else. In my case, probably more unusually, I was having a workup to have a heart transplant when they found cancer in my heart and in my kidney. And then my GP, she'd never actually said cancer. She talked about lesions and masses and nodules, but I sort of got the idea that it was cancer, and then I was just profoundly sad.
Well, curiously, I didn't really react to it very much at all. I didn't know quite how I felt about hearing that I had kidney cancer, because it seemed to me to be just something that I wasn't feeling internally. We had a family member who had kidney cancer and had died. So I was more calm and more relaxed than really I should have been, but that's probably a result of sheer ignorance. Normally, if I find that I've got something to learn about, I hit the websites. I go to Nurse Google and Dr. Wikipedia, and I'll get the leaflets, and I want to find the ins and outs. But with kidney cancer, and without suggesting that I was actually burying my head in the sand, I really didn't do any of that. It was only later, when 4 years after original diagnosis, when the secondaries were identified and I was put on a drug called sunitinib, that I started to read up about sunitinib and started looking around for people to talk to. And at that point, I stumbled on KCSN and the Facebook group, which then became a key information source for me.
It was kind of strange because I didn't initially know. I didn't know I had kidney cancer until after they'd taken the tumour out. So I had the sort of scanxiety, if you like, leading up to the operation and after the operation, of waiting for the reports to come back to see whether it was or it wasn't. I remember my oncologist my first session with the oncologist post surgery, said, "Oh God, you're a technologist. You know, you'll have gone on the internet and you'll have found the shark's fin and all the snake oil," sort of warning me against it. And what I did find, actually, there wasn't that much information at the time. As you know, I eventually set up a website because I'm a techie. And I set one up because the second I got my pathology report, I didn't understand a word of it. And there was nobody really there to explain it. I had to go and ask my GP what some of the things meant. Speak to the clinical team, speak to your team. It doesn't have to be your urologist or oncologist. It can be the nursing teams, just to find out what you're going to go through and how to deal with it. I suppose one of my regrets, although I don't think it would have changed the actual treatment, is to find out what choices I had. Are there any choices? You know, what am I likely to expect?